60% of all pets will develop cancer at some point in their life. This is a huge statistic, and pet parents need to know what we can do to help your pet avoid becoming a statistic. So Sue, this is a great question. So she asked, are lymphoma and cysts different? Yes. So lymphoma is going to be more of an internal, it's your immune system cancer. And we usually diagnose lymphoma because we feel lumps on certain areas of the body, and those are actually lymph nodes. So we see the lymph nodes get really big because the body's working overtime. The white blood cells aren't being produced in the right way. The immune system is a wreck. And so we'll see lymph nodes pop up in the front, right in front of the shoulder blades, the prescapular lymph nodes. We'll also see submandibular just behind the jaw, the angle of the jaw is where you can feel. Now we have to keep in mind there's salivary glands in that area too. And so if a pet has inflammation in its mouth, it has dental disease, those lymph nodes right here can be inflamed for other causes. So if you feel them, and they're super easy to feel usually, so a lot of pet parents will feel and go, oh my gosh, my pet has lymphoma, and they don't. So you can feel in front. The other good area that we tend to feel enlarged lymph nodes is right behind the knees. So that's the popliteal lymph node. So that's what we're looking for when we see like skin lumps and bumps. Yes, we can feel lymph nodes. That's going to be an internal cancer. And that's where we treat that very differently from like, say, a cyst. So a cyst, common thing, most common lump and bump or lumps and bumps that I would see would be lipomas, your fatty tumors. Those are typically benign. We'll come back to those. And then cysts. So they're like the smaller little, usually they don't have hair on them. We call that alopecic. They are possibly like red, but they're not typically ulcerated. So broken open, oozing, crusting. But with cysts, a lot of times, so we can see follicular cysts, and it's where that follicle is pretty much like flipped upside down. It's ingrown and it can create irritation, and it's still producing sebum, that oil that hair follicles produce, but it's impacted. And so sometimes what we'll see is they break open, they might ooze like white, gross, chalky material. They can get secondary bacterial infections where we have to treat them with antibiotics is the traditional way to treat those. So cysts are going to be benign, but they still represent an imbalance. They still shouldn't be forming. And if you have a cyst that's creating a lot of problems, it's breaking open, we do have to surgically remove that because we need to remove that hair follicle to get rid of it. But keeping in mind what I just mentioned, like, is the food right? How do we change the environment in the body so this doesn't continue to pop up? So that's really, really important. Now there's things that we can do topically to help with secondary infections. We just did a series on essential oils, and using essential oils topically in a carrier oil, diluting them, but using certain ones for their antibacterial properties. So we can use topical. Manuka honey is another great option that has antibacterial properties that you can use. It's not going to make the cyst go away. It's not going to treat the underlying problem, but it's nice because we can hopefully avoid having to use antibiotics and affect the microbiome. So affect the GI health, which is usually one of the main reasons why these are forming, because the GI system is not optimized. It's not optimized because the food we're feeding isn't appropriate.